You may be aware that psoriasis is considered a chronic condition. However, would you believe it if I told you that psoriasis can be treated? Watch the following video and I will explain the secret behind how psoriasis can be treated. Have you ever wondered how a psoriasis patient who suffered due to the severe rebound effect after discontinuing immunosuppressants found treatment? Watch the video until the end. Your psoriasis can also be effectively treated. Hello, I am Dr. Park Sung-bae, a traditional Korean medicine doctor who has been treating psoriasis for 33 years in South Korea. Today, I would like to explain the astonishing secret of psoriasis that is unknown to anyone worldwide. Psoriasis is one of the representative chronic skin conditions. Many psoriasis patients ask their attending physicians, "Doc, why do I have psoriasis?" Perhaps you haven't heard a precise answer to this question, as unfortunately, the exact cause of psoriasis onset has not been clearly elucidated to date. However, extensive research across various fields highlights immune system abnormalities as the most prominent factor in the development of psoriasis. Scientists have conducted numerous studies to find treatments for psoriasis, discovering that the levels of cytokines in the blood of psoriasis patients are higher than those in normal individuals. Cytokines are relatively small immune proteins found in the blood, primarily produced by immune cells. When our body is invaded by bacteria or viruses, these immune cells initiate a fight and simultaneously release cytokines, a process known as immune response. Let's go back into the bloodstream of psoriasis patients. Scientists hypothesized that if they could lower the levels of cytokines, psoriasis symptoms would improve. Through clinical experiments using immunosuppressive medicine to reduce cytokine levels in the blood of psoriasis patients, they confirmed that the actual improvement of psoriasis symptoms occurred. Currently, the majority of psoriasis patients worldwide are undergoing treatment for psoriasis using immunosuppressive medicine based on the results of these clinical experiments. Through the Secrets of Psoriasis series, I aim to address the shortcomings of modern medicine's approach to psoriasis treatment and provide alternatives by discussing actual clinical cases. In the first video, I will showcase the skin condition of a psoriasis patient undergoing long-term treatment with immunosuppressive medicine. This is to illustrate the therapeutic effects of immunosuppressants and provide an understanding of their effectiveness in treating psoriasis. In the second video, I will demonstrate how the skin condition of the psoriasis patient changes after discontinuing the immunosuppressive medicine currently in use. This is to illustrate the potential side effects that may occur when immunosuppressive medication is discontinued after long-term use. In the third video, I will demonstrate how the symptoms of psoriasis change when the patient takes HMV, a medication from Hanulmeum Korean Medicine Clinic, which works to normalize the immune system. This is intended to compare the effects of immunosuppressive treatment with the approach of normalizing the immune system, aiming to evaluate which treatment method may be more appropriate. If you have a precise understanding of psoriasis and realize the shortcomings of incorrect treatment methods, the formulation of a proper treatment plan can prevent psoriasis patients worldwide from suffering any longer. From now on, we will examine how modern medicine's approach to treating psoriasis has been flawed, exploring one clinical case at a time. Would you like to see the skin condition of a psoriasis patient who has been undergoing long-term treatment for psoriasis using immunosuppressive medicine to suppress the immune system and control the abnormal growth of keratinocytes in the skin? The patient in this video has been using immunosuppressive medicine for over a decade. Psoriasis, measuring 5 to 10 centimeters, is present on the waist, arms, and legs. The affected areas exhibit a slight redness with mild scaling visible. He doesn't seem to experience significant discomfort in his daily life, as the visible psoriasis symptoms are not severe. The issue is that due to the long-term use of immunosuppressive drugs, the patient's liver condition has deteriorated significantly as a side effect. the attending physician has decided to discontinue the medication. Immunosuppressive medicine have a short-term effect of suppressing the inflammatory response in the areas affected by psoriasis, preventing the worsening of symptoms. However, caution is necessary with long-term use, as it can lead to increased toxicity in the kidneys and liver. Having experienced that discontinuing immunosuppressive medication leads to the worsening of psoriasis symptoms, even after improvement, the patient sought alternative treatment options. This led him to visit our clinic, expressing a desire to explore different approaches for managing psoriasis. I advised him to gradually reduce the immunosuppressive medication to avoid the rapid worsening of psoriasis symptoms, known as the rebound phenomenon, that can occur when abruptly discontinued. Wouldn't you curious about how his psoriasis symptoms changed after he stopped the immunosuppressive medication? In this video, taken after 2 weeks of discontinuing the immunosuppressive medication, numerous small rice grain-sized spots have spread across the chest, back, arms, legs, and face. The spots are clustering together, progressing into a plaque-type psoriasis. After discontinuing the immunosuppressive medication for 4 weeks, psoriasis has spread throughout the entire body. The leg areas in particular are swollen and painful due to psoriatic arthritis, making it difficult for the patient to walk. Immunosuppressive agents, as the name suggests, are medicine that block the abnormal activation of T cells among immune cells, preventing the immune response and the subsequent inflammatory process. Wait a moment. If psoriasis symptoms improved with the use of immunosuppressive medicine, shouldn't the improvement be maintained even after discontinuing the medication? Why does such a severe rebound phenomenon occur? The psoriasis symptoms, suppressed tightly by the immunosuppressive medicine all this time, may appear to have improved externally. However, when the medication or ointment is discontinued, the weakened restraint on the immune system provides an opportunity for the suppressed psoriasis to explosively resurface. The reason chronic skin conditions like psoriasis are difficult to treat lies right here. In an attempt to reduce the rebound phenomenon, stronger medications are often used. However, discontinuation may occur again due to abnormal signals from the body, leading to a recurring cycle of discontinuation and subsequent rebound. If that's the case, how can we avoid abrupt rebound phenomena? Typically, for psoriasis patients discontinuing immunosuppressive medication, a tapering process is needed, gradually reducing the medication dosage step by step. However, as seen in the video, for individuals who have been dealing with psoriasis for a long time, tapering alone may not result in an improvement of psoriasis symptoms, because the fundamental cause, which is the immune system dysfunction, has not been addressed. The key to treating psoriasis is restoring the compromised immune system of psoriasis patients to a normal functioning immune system. Immunity is the power within the human body that enables it to overcome various diseases and live a healthy life. Suppressing the body's immune system makes it susceptible to various illnesses, especially in the treatment of psoriasis, a chronic skin condition closely related to immunity. Various side effects resulting from immunosuppression are already well known. If we were to treat psoriasis by normalizing the immune system, instead of suppressing it, what results could it yield? Let's examine the progress of a psoriasis patient who received immune normalization treatment, starting 4 weeks after discontinuing immunosuppressive medication, as shown in the video. In this video, taken 2 months after starting the medication to normalize the immune system, you can observe a change in the skin's redness from red to pink, and there is a significant reduction in scaling throughout the body. In this video, taken 4 months after starting the medication to normalize the immune system, you can see a change in the skin's redness from red to light pink. This video, taken 9 months after starting the medication to normalize the immune system, shows that the skin throughout the body has almost completely recovered to a normal state. Isn't it astonishing to know that psoriasis can be treated using a method that normalizes the immune system? Let's compare immunosuppressive therapy with immune normalization therapy. The psoriasis symptoms, which worsened after discontinuing the immunosuppressive medicine, significantly improved after taking the medication to normalize the immune system. The treatment of psoriasis using immunosuppressive medicine can lead to a rebound phenomenon, where symptoms worsen again after discontinuing the medication, despite initial improvement. The treatment of psoriasis using medication to normalize the immune system does not result in a rebound phenomenon, where symptoms worsen again after discontinuing the medication, even after improvement. Which treatment method do you think is the right? One among the two?
Traditional Korean medicine is based on science. The treatment methods at Hanilmayam Korean Medicine Clinic, where patients can receive treatment with confidence, are the results of continuous research. The concentrated research efforts of the medical staff at 23 branches of Hanilmayam Korean Medicine Clinic have resulted in an objective, scientific, and systematic treatment system. We actively engage in overseas SCI-level paper presentations and various academic conference activities. Beyond South Korea, Hanilmayam Korean Medicine Clinic's treatment system encompasses the world, now offering hope to skin patients worldwide.
감사합니다. 감사합니다.
Спасибо клинике Hanilmayam.
Thank you.
Thank you.